Hi, welcome once again to Healthcare Hoax Videos. I'm Janet Cimorelli, licensed nutrition counselor. I'm here with Dr. Herb Slavin today, and today we're talking about headaches. Oh my goodness, so many feet of shelf space devoted to remedies, over-the-counter remedies for headaches. They're so common, people think it's normal. What do you think about that, Dr. Slavin, when they say it's normal?
That's a very good point. When things are common, people believe it's normal. And that justifies having all those drugs available over the counter because, after all, it's normal. It's no big deal. Headaches are complicated because there are so many causes of headaches. The physician should actually take time interviewing the patient so he can discover what's causing the headache, because it makes, in my opinion, a lot more sense to remove the underlying cause than to just cover it up with an over-the-counter drug.
Wouldn't that be using common sense? So sometimes it could be stress, sometimes it could be hormones, sometimes it could be circulation. So there's so many different issues. How might you decide what the causes could be?
Well, that's why you have to spend time talking to the patient. For example, you might say, when do you get the headaches? If they say they get it in the morning, then you have to start thinking maybe it's caffeine withdrawal.
Wow, okay.
You know, something like that. They haven't had caffeine now all night, and that's one of the side effects of caffeine withdrawal, headaches.
It could happen that quickly, so
Sure.
that overnight while you're sleeping?
Well, the caffeine is, you haven't had, all day long you're drinking coffee. Now you're going for several more hours without it. Some people can experience headaches from that.
Wow. What about low sugar? Might you possibly experience a drop in blood sugar levels in the morning? Is that?
It could be, that's why when you interview the patient, you want to find out what time do you get a headache in relationship to eating, in relationship to maybe activities. Exercise can trigger headaches in some people.
Really? Wow.
So it's, anything is possible. So, but you have to spend time with the patient. That's not being done these days. Oh, you have a headache? Here's a prescription. Furacet.
Wow.
Furanel.
Right,
something.
right. And so, in addition to those possible prescription remedies that might be handed to you by your doctor, there's over-the-counter non-steroidal anti-inflammatory drugs. And those non-steroidal anti-inflammatory drugs, the list could include Tylenol, Advil, Aleve, aspirin, as common as that. Now,
Well,
it's
just to be accurate, Tylenol's not a non-steroidal.
Okay, sorry.
So,
I take it back.
but
Take it back.
it's one of
Okay.
the common pain relievers people use.
Okay, and my area of concern is people don't necessarily think that if they can take something off a shelf and use that, and it's successful, it gets rid of their headache, that it might have side effects. So would you say that using those things on an occasional basis, you could have relative safety with their use? But if you're doing it day after day after day, what's the problem with that? It takes care of the headache.
I would say, first of all, headaches are not normal. They're common, but not normal. So if you have a headache, even if it's only once a month or once every other month, you still have to figure out what's causing it. Wouldn't be a serious problem, though, because the serious causes of headaches could be a brain tumor. So you go from one spectrum to the other, things that are just, minor causes to more serious causes. But if you're getting a headache every day and you wind up taking a non-steroidal, an Advil every day, you really have to investigate why, because that clearly is not a good approach, because you've got the headache and whatever's causing that is a bad thing, and now you're taking a drug with its associated side effects. So you don't want to, wind up ignoring the underlying cause and just covering it up with the drug.
critically important information, and that's our healthcare hoax video for today. More will be revealed when we talk to you about the causes, the symptoms, and some of the natural solutions so you don't have to be hoaxed. Remember, when you go to healthcarehoaxvideos.com, you'll be notified when a new video on healthcare hoax is posted, and you'll find out the next level of information. Remember, when you visit our site, make sure you like us, share it with your friends and family, and stay tuned for our next healthcare hoax video.